Colon cancer is, again, among the top cancer killers of both men and women in America. Of all the cancers, it's one of the few that is completely preventable by screening. The most important thing is for men and women, when they hit the age of 50, to begin a program of colonoscopies to screen for colon cancer. One major risk factor for colon cancer is your family history. And it's not always a family history of colon cancer. If you have other cancers in your family, it may increase your risk of colon cancer as well. It's very important to talk with your doctor about this. At this hospital, we have a genetics counselor that can also contribute and help answer that question as well. There are data that indicate that a diet that's low in fiber and high in fat, the so-called Western diet, may contribute to your risk of colon cancer as well. Colon cancer, like other cancers, often doesn't have signs and symptoms. Some of the things that people classically talk about is a change in your bowel habits or noticing blood in your stool. Unfortunately, these are not reliable ways to tell if you have colon cancer, and the most important way to check is by screening. There are several elements to screening for colon cancer. Your family physician can check your stool for what we call occult blood. That's blood that you can't see in your stool. The most important thing, however, and the one that's been validated by careful evidence, is the need to have a colonoscopy beginning at age 50. That looks for polyps, which are precancerous lesions in your colon. If those polyps are found and removed, it markedly lowers your chance of dying from colon cancer. It's one of the cancers, again, that's been proven over and over and over again to be preventable by screening. In some cases, for example, if you have a strong family history of polyps, colon cancer, or inflammatory bowel disease, it may be important for you to begin your colonoscopy earlier, even as earlier as in your 20s, for example. It's very important to talk to your doctor about this to see if you're one of those people that needs colonoscopy earlier than age 50. Early stage colon cancer is curable by surgery. Ideally, people will never get to have colon cancer if they have their colons checked and polyps removed. But for those patients that have colon cancer, it can be cured by surgery in most cases. Later stage colon cancer, the treatment would include surgery plus chemotherapy, or potentially, in the case of rectal cancer, the addition of radiation in the mix as well. Like lung cancer, colon cancer is a team enterprise that requires cooperation between gastroenterologists, surgeons, radiation oncologists, and medical oncologists. All those folks are part of the team here and work together closely to care for the patients. We also have National Cancer Institute sponsored clinical trials as an option for patients with colon cancer here. So a patient shouldn't feel like they have to travel to the big city to have access to those things if they want to.